Hi guys, Dr. Gillard here. Sorry about that. I just hate virtual classroom with a passion. This is Zoom. All right, here we go. Sorry, virtual classroom just as a loser. Zoom is handling this meeting. Plus, I'm recording it on Camtasia. Plus, I'm recording it on the Sony that's videoing this. So let's go over the sacrum. I'll post this on YouTube. So this is the posterior surface of the sacrum. This is exactly how I did it for class yesterday. We started with the anterior surface of the sacrum. So we have these lines are probably the easiest to see. So those are the transverse lines or transverse ridges. So they separate the bodies. This would be the sacral body, all of this big chunk of bone right here. That's the S1 sacral body. This is the S2 sacral body here. S3, S4, and S5 right there. These lines are where discs used to be. Remember, by about the age of 20, your discs are gone. They fuse, and these bones fuse together, but they kind of bubble up into a line called the transverse line. And you can see the transverse lines quite nicely here. Right? We can see this little lip of bone here. See how that's kind of poking out? And I can turn this over to the side. You can also see it right here. That's called the sacral promontory. Sacral promontory is part of the S1 vertebral body. Specifically, this top part is called the vertebral end plate, the superior vertebral end plate. You can't see the inferior vertebral end plate, but that's where that little lip of bone is here now. So let's look at the parts. We have this piece of bone right here in between. See that? So that embryologically, that's the stuff that gave rise to your ribs. But of course, you don't have any ribs in your sacrum, obviously. But the same tissue gave rise to this. So this is primordial kind of rib mesenchyme right here. But it's typically called a bone bar. So, because it kind of looks like a bone or bar, maybe you could imagine that's a little rib coming off the vertebral body, but that's a bone bar. If we go out further into this land, the lateral part of the sacrum, all of this region, so that's called the lateral mass, and that's a primordial transverse process tissue that gave rise to all this. Sometimes it's called that. Primordial transverse process tissue. But it's better to be called the lateral mass. So we have body, we have bone bar, and then we have lateral mass. Right? This lateral mass up here, that's got a special name. That's called the ala of the sacrum, or the sacral ala. Okay, sacral ala. We can also see these holes. Those are on the anterior. We're looking at the anterior surface here of the sacrum. So those are the anterior sacral foramen, and that's where the anterior rami come out of, which we'll talk about tomorrow. We'll talk about the wiring of this thing tomorrow. That's about it. We'll get to the back side of this in a second. So that's the story with that. Let's flip it over now. This is much more complicated on the back side. So this is the posterior surface of the sacrum. So we have 3 mountain ranges. 2 are easy to see, 1's not so easy to see. So we have a mountain range running down the middle here. Those are called the sacral tubercles. Sacral tubercles, right? This is the S1 sacral tubercle. We just talked about this one in class. See how it's split right here? So that's called the spina bifida occulta, and this bump here called sacral process failed. The S1 sacral process, or sacral tubercle, you could call it. It failed to ossify into one unit. S2, S3, S4 is actually split, and then we have no S5, right? And that's the sacral hiatus that we just talked about. Sacral hiatus, I can put this, well, this one I can't go all the way up on, but the sacral hiatus goes all the way down, and it communicates with there we go. See how it goes all the way through? That's the sacral canal or the sacral vertebral canal. And it ends at the sacral hiatus. Then we have these little bumps. If I turn these up right here, you can see those quite nicely. So those are the sacral cornu. Left sacral cornu, right sacral cornu. Sacral cornu is plural. This is kind of the apex of the sacrum here. The sacral intervertebral disc here, or the sacrococcygeal disc, would sit right here. But that's gone. All right, so these are called not spinous processes, but spinous tubercles or sacral tubercles. And the ridge that they form, if this was a mountain range, that's called the median sacral crest. Medial sacral crest is right there. We have an intermediate sacral crest, which is a little more difficult to see. So it's best to, let me tell you what these are first. So these are just the posterior sacral foramen. So we can use these posterior sacral foramen as reference points. You can actually see this one pretty good if I guess it's best like this. But if you go just medial, this is medial. If you go medial to the sacral foramen, there's little bumps right here. There's one right here. I don't know if that helps if I turn it like that. Oh yeah, that's a little better. You can see it kind of, now I can't see it to show you though. Right there. See that? There's one there. There's one right here. So this is where you guys kind of miss out, because if you could pick this up and hold it, you could see these things a little bit better, but hopefully you can see them. Those are called articular tubercles, and those are the remnants of the articular processes or the articular pillars that make these, right? And they make up the intermediate sacral crest. So the intermediate sacral crest is made up of articular tubercles, which live right there. All right? If we go lateral this way to the posterior sacral foramen, we have some gigantic tubercles here. If I turn it like this, you can really get an idea. I mean, you can see it right here. And you can see it right here. See that? So those are transverse tubercles, and they collectively make up the lateral sacral crest, which would be lateral to the posterior sacral foramen. So we have medial sacral crest, intermediate sacral crest, lateral sacral crest. These are made up of spinous tubercles. These are made up of articular tubercles. These are made up of transverse tubercles. See how that works? And we'll talk about this view, we'll talk about next week. All right, is that about it? I think that's about it. I think we also looked at this view. So let's take a look at this view. Let's see, how do I get that? Oh, there we go. Centered a little more. Okay, so this is sacral base. I think that's one of the answers or the things you have to know. This is all sacral ala. So all of this is sacral ala. Sacral ala stops right about here. There's the first sacral foramen. So, but this is still all sacral ala, this material. It's really the S1 lateral mass, but it's called sacral ala, and that's understood. It's S1. This is the sacral base. You could call this the superior vertebral bony end plate of S1 as well. Sacral promontory would be that lip coming right off the front. You can see it pokes out more. And is that it? Then these are really important. We'd spend a lot of time on these today. These are the sacral articular processes right here. They're really the superior articular processes of S1. Let's see, I guess I could put it back like that so it's not looking weird to you. So you can see those quite nicely. There's a nice smooth surface here. That's because there was articular cartilage on there at one time. L5, I do have L5 that goes with this one, I think. L5 comes down like this. Is this a match to this? No, this one's too big for it. But L5 would connect to it like that. Let's see if I can. This one, let's look at another one. So L5 would come down. There's the match. See how nice that fits together? And it makes these facet joints, right? These are the L5S1 facet joints, or L5S1 zygapophyseal joints, only they don't have a capsule around them. Spinous process of L5, transverse processes of L5. Oh, look, here's the supraarticular processes of L5. All right, see how that works. And what about the sacral hiatus on this one? I think I have to tip this to the side a little so we can count the spinous tubercles. There's 1, there's S1, S2 is here, S3 is here, then there's nothing. So this is the most common, this is probably most of you have this in your sacrums right now. So you have a spina bifida S4 and a spina bifida S5. I also showed them that we have the sacral hiatus, or the cornu right here, sacral cornu, coccygeal cornu, and on this side, the intercornual ligament turned to bone, and so it calcified. So I told the people yesterday, would you want to do a coccyx adjustment on this patient? No way. You'd snap the bone off. They'd sue you. They'd be in horrible pain. So you got to be very careful with that coccyx because it can fuse. Sometimes it's a disc here and it moves. Sometimes it's fused. All right, I think that is pretty much all I needed to say. I guess one more thing I could say, and then I'll go. So this is the sacral canal, right, or the sacrovertebral canal. This is the roof. The roof is made up of the lamina, right? This is the floor. It's made up of the vertebral body, or the sacral body, if you will. It's still a vertebral body, the vertebral body of S1. This is the pedicle right here. Right? And that's kind of sometimes called the wall, or the lateral wall of the sacral canal. And that should do it. All right, so sorry that virtual classroom didn't work, but it's weird that Zoom works and everything else works, but not virtual classroom. They need to get their act together. All right, you guys. See you next time.